standing here in front of Tampere Hall in Finland for the 18th Nordic Congress of General Practice 2013. The conference has more than 1,100 doctors from 30 different countries. I'm also having two presentations, one on antidepressants and the other on influenza vaccinations. Okay. Yeah, my name is Sven Frederick Østerhus. I'm a doctor from Denmark, and I will talk to you about the evidence, or rather the lack of evidence, for using influenza vaccinations. So this is a very controversial topic, considering most Western governments advocate strongly to vaccinating larger or smaller groups of the population. The background in Denmark, we vaccinate certain subgroups which we consider at a higher risk of developing influenza, severe influenza, or complications thereof. These include the elderly, certain chronic diseases, obese, pregnant, early retired. Also, if a doctor finds that an influenza vaccination might be appropriate for a certain patient, they might also get a free vaccination. So we are actually pretty well covered in Denmark. And who gives the vaccinations? First of all, is the general practitioners. Usually they have a whole day or half a day they set off when you're closing in on the seasonal influenza. And then a lot of people, they come and they just pick a number or something like that and get the shots. Usually they don't get any information on side effects. That's just reality. And they go out without waiting for 3 minutes or 30 minutes. You also have private vaccination companies, not just offering the vaccination to firms and stuff like that for their employees, but also in the communities, elderly care institutions, places like that. They also offer their services for a fee, of course. Now this is from Danish Sundhedsstyrelsen, the Danish health authorities. It's a sign saying "Get vaccinated now," and you have an implementation going. I searched the Cochrane library for influenza studies, analysis considering influenza vaccinations and certain subgroups are both healthy and ill, and I found 11 analyses, which I will talk about here. I also searched the PubMed, but did not find any additional analysis. First of all, I've divided it into some groups here, just to make it a little more friendly for you to see. And I've extracted some of the data out of it. We have an analysis considering what is the evidence for vaccinating children under 16 years of age. They did not find any useful data for children under 2 years of age. Not so relevant in Denmark, but in the States. In the United States, they're very fond of vaccinating young children, lesser than 2 years. There was not found any evidence for an effect of the influenza vaccinations on complications, like pneumonia or serious complications or mortality on the children. They did find, though, that a lot of the trials had a high risk of bias. And that is, many of the trials, which were sponsored by the pharmaceutical industry, lacked randomization, they lacked blinding, they lacked allocation, concealment. They also had found very good evidence for outcome reporting bias. So they have picked the kinds of implications and effects that they like and taking it out, and then they use that in their reports instead of telling the actual real picture. So I haven't written it here, but they did actually show a little, depending on what kind of vaccine they used and what kind of virus strain that was active in the specific season, there was some effect on decreasing the cases of influenza or influenza-like symptoms, but not any effect on complications. Okay, the healthy adults, I'll just go quickly on this. A little much the same. You find some effect depending again on the type of virus and type of vaccine. Number needs to treat between 3 and 100 to reduce influenza symptoms. Now, this is not necessarily influenza cases itself, but when you make studies like this, you just get the whole, types of outcomes, and it's not necessarily the vaccine that has helped them, but well, that's what they found. Different nominees to treats. Fairly high, I'd say, when you're thinking about influenza, generally speaking, in the healthy population, being not a big deal. They did not find any effect on sick days, which is perhaps why the employers would like to vaccinate their employees so they are not sick and away from work. So they did not find any effect on them, no significant effect, not either on complications or mortality. Side effects, bad testing for this. They couldn't really use the data they found in the analysis to say anything certain about that. Okay, now, more relevant for the Danish, we are vaccinating the risk groups. Elderly above 65. We have something called a medical technology. We think, what you have the government makes an evaluation of what should we do with the influenza vaccination. It's called a medical technology evaluation. They say it's 17 the number needs to treat. Well, the Cochrane analysis find that the number needs to treat is 41 to avoid 1 case of influenza. And again, they did not find any effect on complications, mortality, and what you really want to avoid when you're dealing with the elderly and influenza. And again, high risk of bias, and same cases as I mentioned earlier. Health personnel working with the elderly, there's also been analysis both for the health personnel themselves, but also for the elderly they are working with. Again, no effect on either influenza or pneumonia, and considering, again, high risk of bias. Influenza vaccination and pulmonary disease. The chronic obstructive pulmonary disease, as we talked about earlier here, and they did one study from 1961 with 55 participants, found actually an effect on so-called late exacerbations, which is a COPD exacerbation 3 to 4 weeks after an influenza vaccination. So, again, you have the industry, they are making many outcomes, not just one outcome or 2 outcomes, they have 10 or 20 outcomes. And one of them shows up, okay, whoa, we have a decreased late exacerbation. Well, that was actually the only effect that was found in all of the studies that has been done on all of the controlled trials. I mean, the certain good studies that were used in the analysis for influenza vaccinations. This study had a low risk of bias. It's unusual during this 11 analysis. Asthma, no effect on complications. There had been some talk about that the influenza vaccination itself could increase the number of asthma exacerbations, but they did not find either an increase or a decrease in the number of exacerbations. And not in pneumonia and all that stuff either. This analysis had also a low risk of bias. Cystic fibrosis, no effect was found. Bronchiectasis, no studies were found. Okay. Malignant disease, children treated with chemotherapy against cancer, no effect was found. The problem here is, also some of the other trials, is that they use surrogate measures. That is, instead of measuring the effect on mortality, pneumonia, what we really want to protect these kids, the sick kids from, they don't check the measures on that. They have outcome measures like antibody levels. So they did the influenza vaccination, and then they measured the antibodies created against the influenza virus. But that's not the same as that they are avoiding pneumonia or mortality or whatever serious complications that you have to influenza. Hematological malignant diseases, they found actually some effect. Now we need to treat on 3.1 for lower respiratory infections like pneumonia, and now we need to treat with 2.3 for hospitalization. But these studies also carry a high risk of bias, so I will not take the results too seriously. Also, there's been some talk about influenza vaccination being able to prevent cardiovascular disease. There are actually 2 studies called the flu cat and the flu vac. The flu cat had 658 participants. They did not find any effect, low risk of bias. The other study, the flu vac, had lesser participants, 200. They found actually a nomenclature of 6 for secondary cardiovascular death. That is, if you have had a myocardial infarction, then if you get vaccinated with influenza vaccination, you reduce, in the 6th is reduced to 1 cardiovascular death. It had a moderate risk of bias though, and considering the bigger flu vac and better performed study of the flu cat, I would say that the effect is not number to treat. 6. If you combine the two of them, the number needed to treat is 170 to prevent 1 secondary cardiovascular death. Okay, so if the vaccines aren't working so well as we thought they are, then what to do? Well, start washing your hands. That's a very good alternative, and you also have some studies actually, it works actually better than vaccinating, especially when you're doing it, not doing this, but doing the sleeve sneeze. Instead of sneezing in your hands and shaking your colleague afterwards, do the sleeve sneeze. Also, you have another one you can actually cough like this. Just don't cough in your hands. And of course, keep calm and stay at home. Sick. Nobody is going to thank you for coming to work and giving them the flu. Stay at home. These measures together are more efficient than influenza vaccinations. Thank you for listening. Any comments? Questions? Yes, I'm going to publish.